Welcome to a series of podcasts from the BAME Health Collaborative. Today it is with great pleasure that I've got two amazing guests to meet you here today. The first guest is Michaelene Holder-March, who is the founder of BAME Health Collaborative. And I also have Professor Jaiyesimi within the studio as well, all here to talk to you about the wonderful organisation that has been created. So if we could go to Michaelene first, please.
Hi.
Hello, Michaelene. How are you?
I am well. And how are you?
Oh, good. Thank you very much indeed. Michaelene, you are the founder of this fantastic charity. Tell us a little bit more about it.
Well, what happened is that I had a couple of friends. One of the parties is actually as a trustee who had undergone some surgery, and during that time it wasn't optimum care. The care was poor poor, as well as I had another friend who is a doctor, and she also had undergone the most horrendous care. And I thought of it, and I thought, well, they're clinicians. They are part of this system that we call the National Health Service.
Mm-hmm.
And one of the parties involved is responsible for patient safety and governance and compliance. And I'm like, something has gone wrong here. And therefore, what am I going to do? Am I going to sit back and just not do anything?
Sure.
So in February, I started to draft what it should look like. Is it going to be a reactive organization? Is it going to be proactive? And I decided that reactive is not the answer. We need to be proactive. We really need to be at the table where the decision makers are. And the only how to do that is going back to basic framework, which is policy, drive policy, sit at the table, the clinical guidelines, the standards, all the pillars that healthcare is built upon. We must be there to decide about it. Now, people ask, why you didn't call it Black Health Collaborative? And I said, it affects all minorities. I am Black, despite the fact, the fact is I have family who are Asians as well. And therefore, I need to also represent them. I need to ensure that all are represented. We have Gang, who is Chinese, and he come across so much abuse in his community. And so therefore we need to address all of that. The Bangladeshi, the Eastern Europeans, the Gypsies. We need to ensure that the table is prepared in a way where individualized procedures are taken into account, people, culture, their tribes, their religion, the sensitivity, the food that they eat. All of that has to be taken into account. It's no longer what it used to be. You have to respect that.
Yes, of course. And of course, what we're seeing now is that you've started this initiative. It's obviously taken off. You've got some incredible people that you're working in partnership with and who've come on board. So tell us a little bit about that, because obviously this was the right thing at the right time and you've hit the nail on the head.
Yes, and then in just coming up to just after my birthday, I reached out to 5 key people who are known to me very well, and they include Professor Rotimi, Helen Davenport. I reached out to them, Mawson. I reached out to a few people who some said yes, some say no. But I reached out to them because I knew they would be impactful, including a few ambassadors.
Indeed.
And therefore, as you know, you're an ambassador for BHC. I really had to sell the game and make sure that you understand. And Moinul as well. I really wanted him on so much that I was sending him Facebook messages and going, we need you, because this is not only a clinical pathway. We don't want only clinicians and nurses and healthcare professionals across the board. We want all. It's together. Together we can. And we need that patient voices. We need carers to speak up. We need the elderly person who is at home to speak up. We need that sort of communication to help build a better framework for tomorrow. This is not about Michaelene. It's not about BHC. It's not about the ambassadors who are actors or whatever. It's not about the great consultants and doctors we have. No. This is about ensuring that we prepare a better platform for their negotiation, decision making, and conversation about the healthcare for BME. And most importantly, that we are at the table when there's a review, when things go wrong. Nothing is perfect. We don't expect perfection from the NHS at all, any organization, but we want to be at the table when you're reviewing that so lessons can be learned.
And you've achieved a huge amount in a very short period of time, which is absolutely astonishing, to be frank. And what do you put it down to?
You know something, I'm a go-getter. And before coming to all the different parties who are involved now between the ending of April to May, I had already started, all the basic foundation work, the organogram, all that work that needed to go in, drafting all the essentials that is necessary. And I'm sure Professor Rotimi, he's somewhere right there, and he would tell you, I said, you would be for service and acute and primary. You can't say no. And he goes, oh, yes, I love that. So I'm sure he will jump in onto that.
Excellent. Well, you've just mentioned Professor Rotimi Jaiyesimi. Welcome. Lovely to have you here as a guest on the show today. So you're a trustee of the BAME Health Collaborative.
Good evening.
What inspired you to come in and become a trustee?
Good evening.
Hello. So what inspired you to become a trustee for the BAME Health Collaborative?
I can't hear me. Can you hear?
I think we're having a little bit of technical difficulty
there as well.
with Professor Rotimi. But what I can say to you is that Professor Rotimi is well known for doing a lot of community engagement. So being an associate medical director, we worked together on a professional basis before, and we manage public health major cases that impact thousands and thousands of people. And we worked closely on that and delivered a very positive outcome.
Indeed.
So I knew that besides being a consultant for obstetrics and gynecology, I knew that his remit will encompass also all aspects. And he's very passionate about BAME health. Yeah,
indeed.
Very passionate about it. So, and patient safety and sepsis and all of that good stuff. So it was really critical to engage him into this process. Alongside that, there were a lot of other developments about engaging community groups, getting the right ambassadors on. That was the key. So like, for yourself, Mimi, I've been knocking your door and you were like very shocked, weren't you? Like, what? Yes, it's about the what happens next. What happens next with that? And so therefore, BAME Health needs the input from all. So we are writing reports now. We're part of NICE. We are part of Parliamentary Week. We are super excited about that. And I've been knocking doors. And Parliamentary Week is due to Zengang, the ambassador. We have Hepatitis Day, which we wrote a big report. It's going off to the Netherlands and the European Journal for Hepatitis. And they're super excited. We have also collaborated nicely with the World Federated Incontinence, and that is great. The Vice President Lynn, the President Lynn, she has actually done a great work with us. She's really for us, and we have so many great milestones that we have achieved in a very short space of time.
Sure. And it's actually quite interesting that you say that, because one of the things that I think we'd like to know, you've mentioned a lot of subject matters. So what are your priorities?
I think the priorities for me is community engagement. That is one. Two is that it will become a much more of an open and transparent in regards to the discussions about health. It's sometimes very painful, like, fibromyalgia, prostate cancer, breast cancer. It's all very sensitive, and culturally could be a bit shy about discussing it. But it's about that, how we address it, but taking into consideration that we have to inform the community. And I think Professor Rotimi is here, and I'm sure he agree with me. It's about informing that community. I want all communities to be informed, even by the language. It's written in a language that they can understand. I hand over to
which is really, really important. Professor Jaiyesimi, welcome back.
Yeah, thank
Have
you.
you sorted your technical problems out?
Yes, I think it's much
better. Fantastic, because you're a trustee of the BAME Health Collaborative. You're also the Associate Medical Director of Patient Safety and a consultant in obstetrics and gynecology at Basildon University Hospital. And you're the Chief Executive Officer for the Trojan Medical Group, which is a health infrastructure group. So what is your attraction to coming in and bringing your skills and talents? Why did you decide to join the BAME Health Collaborative?
The reason probably goes back to 1985 when I came into the United Kingdom. So I have traveled the journey as a junior trainee doctor, finding it difficult to get jobs, seeing how people of ethnic minority were being treated. And fortunately, I was able to break through the glass ceiling to where I am at the moment. And having gone through that, I think I'm in a position to be able to inform people or inform discussions as to how it feels to be on the receiving end and to try and shape things. People who mete out some of these things really don't do it on purpose. You talk of unconscious bias. I think once we engage in a conversation, then things will get better. And I think this is the right moment because COVID-19, for example, has exposed the disparity within the health system, not just for patients, but even for staff members.
Absolutely.
So that is why.
I mean, you raise a really, really topical subject there, because one of the things that was top of the news was the fact that so many, a very high percentage of people who died from COVID were from BAME backgrounds. Do we have any explanation? Do you know why that's the case?
Well, I know that people say it's because of poverty. We're not talking of health professionals who died. The doctors who died were not poor people. They were not living in poor housing. So we cannot attribute that to poverty or discrimination. But one of the things I have noticed at times is that the ethnic people or the minority people are pushed forward to the forefront, to the battlefield, while you have our Caucasian colleagues at times on the forefront as well, but at times in the back room. And I think that is one of the reasons. And apart from the maybe genetic predisposition to low immunity, there are multiple factors related to this. We cannot say it's just one factor. There's the genetic factor, the vitamin D deficiency, because there's no sun in Europe. Because of the melanin in the skin, we tend to be maybe lower immunity. But there's no doubt that the ethnic minority in the care homes, you find them there on the shop floor, in hospitals, they are there. And there's also the talk about maintaining family. You have nurses who do multiple shifts so that they can be able to support their family here and at home. So it's a complex thing, but I think we've got to address what happens within the United Kingdom. It's a problem that needs to be addressed. The NHS is staffed by a lot of ethnic people. There are quite a lot of Filipinos who died. They are not black, but here We all have different shades of skin. And
Sure.
you'll tell why. So that we have to look at the why. Why has it happened? And we have to be
Yeah.
honest about why.
And do you see then that the BAME Health Collaborative as a charity is going to be instrumental in actually giving you the tools, if you like, not only to do the research with a legitimate sort of branding, if you like, but also to take that research out there and to be heard because of the sort of partners that BAME Health Collaborative is involved with?
I am certain that the BAME Health Collaborative, as it grows, will be able to undertake research. There are lots of scientists, doctors who work within this, who are great scientists. But the thing is, as we are at the moment, we haven't prioritized what affects Black people. Why do Black people get more aggressive breast cancer? Why do Black people get more aggressive prostate cancer? Why is the outcome different? And again, research, when it is done on drugs, trials that are done on drugs, most of them are done on Caucasians. We have to be a voice, encourage our people to come forward for research, encourage our scientists to put applications forward. So in the BAME Health Collaborative, we are going to do that. There are people who are prepared to support us once we put in a good proposal.
So what you're saying really is that one of the vehicles, or this will be a great vehicle for you to tackle not just quality in society, but inequality as well. Because that's really important, isn't it, to you as well as an individual? It's one of your principles. It's part of your ethos.
That's correct. To take away the disparity between races, we are one human race and should be treated equally. And in funding for healthcare, it has to be the same. Together we can. That is what we say. There's not one life better than the other. We're all human, and that's why we have stepped up into this space to carry this cry forward.
Indeed. One of the things you also talked about was the inequalities that exist within just understanding what's going on. So from your point of view, I'm guessing that for you, this is a great vehicle to actually be able to educate people as well. So that if, for example, you talked about some of the cancers or some of the illnesses that were, more prevalent within Asian people. You mentioned breast cancer as one of those and prostate. And sometimes culturally, we're quite embarrassed to talk about our health conditions and our health problems. And especially with something like breast cancer in a man, to actually have to go into a hospital where it's predominantly likely to be women who are looking for treatment. Are you hoping that this BAME Health Collaborative is going to help to educate people so that they can feel that they can go forward and talk about their health issues?
Yes, because we are a culturally sensitive organization, we will address these issues at the table. It's not easily acceptable to find a man and a woman sitting in the same clinic for the same condition. You can compare that with the same-sex word that's been promoted now. Many years ago, on some wards, you will have men and women sharing the same toilet facility.
Yes.
But now in the NHS, that's not allowed. So for breast cancer, you have to have a male clinic as you will have a female clinic. Even in the sexually transmitted infection clinics, you have separate clinics at times for the men and separate for women.
Sure.
And
Sure.
It's not going to take too much to be able to put that in place.
Indeed. I mean, it's common sense, isn't it? I mean, I would feel extremely uncomfortable personally if I had to go into a clinic with a very particular problem, which I was perhaps very conscious about, or maybe I was just very deeply, deeply upset and distressed by it. And if I had to go into a clinic where I was surrounded by, other people, yes, especially men, I think I would feel very uncomfortable. And I can imagine it would be exactly the same as a man. If you've got something that you need to talk about, going into a clinic that's predominantly women must be a very uncomfortable feeling. And it must be quite a brave thing to do, actually, to step through that door. So hopefully with BAME Health Collaborative, you're going to be able to take that message home and actually talk about making sure that this doesn't happen in the future.
Yes, we are going to take it forward strongly, tactfully. I mean, it's a conversation. We have to respect the culture of people. When I say culture, it's the male, is the gender differences here now. Not, well,
Sure.
even some white men will not find it easy to sit in a clinic. It's just like some men can't find it easy to go to an antenatal class. Men find it difficult to follow their spouses to antenatal classes. So it's not just a minority thing, but something that we as human beings at times must know that there is a difference and then meet those differences.
Indeed. I'm going to go back to something that you mentioned a little bit earlier in the interview. You talked about the difficulties of coming from a BAME background and the unconscious bias. And I know this is something, Michaelene, if I can pull you back in as well. I know this is something that you've talked about as well. For both of you, I'd be quite interested in your views about that sort of, if you like, unconscious bias towards people from BAME backgrounds. I think it's something that people in general are not aware of. And I think they would find it very illuminating if you were to be able to shed some light on that and describe what it is you've seen and found.
When we talk about unconscious bias, I don't think there's any, or most Caucasians do not leave their home and say, oh, I'm going to work. And when I say Black person or an ethnic minority person, I'm going to be nasty to the person. No, it's the way people have been brought up. It's the images you see on television.
Yes.
It's what the press portray. When you start putting people in classes, in castes, then it's for the person meeting it out. They don't know the effect it has on the other person. And that is where at times we talk of unconscious bias.
Sure.
They don't necessarily do it. They do it because to them it looks like the norm, but it isn't the norm. And it's the person on the receiving end who feels devalued, unvalued, and that's what we have to address. And unless we open up a conversation between everybody, then we wouldn't. It will still be there. And this is the right time to start the conversation, an open and honest conversation.
Absolutely. Absolutely. And Michaelene, I know that you are absolutely passionate about this particular aspect. This is one of your inspirations.
In 2018 actually, I created an organization called HIDE, which is really foundation, somewhat attached to this, which dealt with inequalities, diversity, and equities. And it was called HIDE, meaning don't hide anymore. However, it wasn't the right time because most healthcare organizations shied away from it. They found it a little bit too much. It was too out there. It was too much in their face. They didn't really engage, but they wanted to be very diplomatic and very quiet about it. With all the Black Lives Matters and all the BME populations around the world recognizing that they have worth, what has happened with that is that there's a whole transformation process. People are much more aware. And I know you were talking about the unconscious bias. One of the things that people don't realize is that BAME communities, they normally involve in some sort of religion, some sort of spiritual growth, some sort of spirituality, which makes them much more into that particular religion, whether it is the Muslim, whether it's Christianity, the Pentecost, whatever it is. But that perception of that person, because of what you heard in the media, does not depict that person in any shape and form. And you have to be able to accept people for who they are. So it's really critical that people recognize and do the unconscious bias test. There's a test that you can do which will tell you whether or not you have bias against anyone. And that will give you an eye opener. And we must not be, before I go, we must not be uncomfortable. My Caucasian brothers and sisters and everyone, we must not be uncomfortable about having that conversation in our homes, amongst our friends. It's the only way we can improve.
Absolutely. And I think the time is now, the time is right. The whole world is actually sitting there ready for this right now. So I think this is the perfect opportunity to exactly discuss all these issues and to actually bring them out in a way that we can discuss them properly. Because I think if you think about the past, people have been scared to talk about things. If they're worried that if they say something out of order, they're going to get eggs thrown at them or tomatoes thrown at them, whatever. And I think people have been extremely worried about expressing their views and their opinions. And what we need to be able to do is have some very honest, open, frank discussions. So do you see BAME Health Collaborative as the opportunity, if you like, to do that?
BAME Health Collaborative is very specific because one of the things is that without health, you don't have the mantra to do all the other things. So I want a healthy BAME population so that it will be able to give you the oomph to tackle unemployment, tackle social housing, tackle discrimination and transport, tackle the airline industry. If you don't have health, you cannot do that. So therefore, this is what I said. I came back to the cornerstone of your development. We are dealing from the time of inception. So from the pregnant woman, the delivery, all the way to the elderly. We want to ensure that your health is managed so that you can have a voice. And even if it's end of life, even if you are disabled, even if you have any vulnerabilities or disabilities, we will want to be the one to stand there and be an advocate for your voice and actually transform that into usable documents so that Parliament and the Department of Health and the military, because I'm writing to the military now, because we want our BAME soldiers, military personnel, to have the best health care that they can have. And it must not be anything but optimum, just as it must be optimum. I'm not saying before you go, I'm not saying that in the Caucasian community we don't have serious clinical incidents or anything like that. I'm not saying that at all. So the learning should actually address all, but we want to make sure that our diabetes and complexities are addressed.
Which is a fantastic aim and objective to have, and it is a wonderful way of putting it. I just would like to thank you very much indeed for coming along today and talking about it. And of course, our wonderful guest, Professor Rotimi Jaiyesimi. It's been wonderful talking to you and learning about your experiences. Thank you for smashing through all those glass ceilings. That's been wonderful to hear, and opening the door for so many other people to follow in your footsteps. On that basis, if I asked you, if there was a key message that you would like to send out there, what would that be?
The key message, in our name is collaboration. We should collaborate with one another. We should join hands together, irrespective of our color, to make humanity better, to make healthcare better for the people we serve, and to make healthcare for the professionals, those who deliver the service, an experience that they savor, a good experience that they savor. I believe that working together as a team, we will achieve more. And that's the message that I'll leave.
What a great message that is. Absolutely brilliant. And very quickly to you, Michaelene.
There's just one thing. All communities across the United Kingdom and beyond, we are open and welcoming your thoughts, your ideas, your suggestions. Everything you say is valuable.
And how can they get in touch with you?
Valuable. And you can get in contact with us. We are on Twitter. We are on all the social media platforms. And you just look it up on Google, and we welcome anything that you have to say that will improve BHC. And thank you for this opportunity.
Thank you very much for joining us. And thank you to my special guest today. It was Michaelene Holder-March, who is the founder of BAME Health Collaborative, and of course, Professor Jaiyesimi, who came along and talked to us. Rotimi, if I may call you that, because I feel we know each other really, really well now. If you want to get in touch, please have a Google, please look on Twitter and join in the conversation. It's a really important issue that we can all work together to resolve. So from all of us here at the BAME Health Collaborative, thank you very much for joining us. And we look forward to your company when we do the next podcast. Thank you all very much and have a very good evening. Thank you.